After respiratory assessment, next important assessment here, because there is a loss of sensation and all, it is better you can assess for skin assessment. What is the next assessment? Skin assessment. Because these spinal cord injury patients are more prone for, because they are having sensation, loss of sensation, and they are more prone for having a bedridden for long time because of their paralysis. It is better to assess for skin. Skin assessment is the next assessment. So, you know what are all the areas? We have already explained in stroke what are all the areas where they are more. If they are in supine lying, what are the areas that are going to be affected? Pressure, sir? Or the occipital protuberance. Next, or the scapular blades. Next is your sacrum. Okay, or this is heel. Next, heel. Okay, next over the heel. Okay, understood? Yes. And what about in case of side lie? Left one. Yeah, we come from here. First is earlobe. Next is the side of the clavicular part, shoulder, lateral part of the shoulder. Next in even, I have forgotten in supine, elbows, olecranon process. Yes. Okay. Next what are the other parts in side line? Crater trochanter and this lateral condyles and lateral malleolus. Okay, these are all the parts. So this is how. So based on the position, you have to check for redness or if there is any ulcer in all these areas. Be careful. Your physiotherapy is very important in assessing these things. Okay, you are the person who have to explain to nurse or doctors that there is some redness because you are treating him. You have to tell him. What is the next assessment after skin? Next is what? Sensory assessment. Okay, you know dermatomal distribution. Based on that, you have to check for pain, temperature, and pressure. Okay, and fine touch. Pain, temperature is one thing. Fine touch and pressure you have to check on dermatomal distribution for knowing the level of injury. Dermatomal for sensory assessment. Okay, and next is what? Motor assessment. You will use manual muscle testing. Wait. Okay, manual muscle testing for motor force. Okay, and you will assess for range of motion. Passive and active range of motions. Passive and active range of motions. Okay, next is what? What else you can do in assess here? Because there is some problem in autonomic and all, better to see for vital signs. Vital signs in different positions. In different positions. I will tell you why you have to see in different positions the vital signs, especially the blood pressure. Okay? Vital signs is also very important because autonomic system is affected, especially it may alter in different level of injury. So it is better to check for vital signs also. Apart from that, functional assessment. Functional assessment. It all depends upon level of injury. If there is any level of injury at the level of C1, C2, C3, what function you can expect from him? What is the function you can expect from him? If there is any level of injury at this, what is the level of function you can expect from that patient? I am having injury here, C1, C2, C3 here. So what functions I can do? Nothing? Nothing? This I can do? That's what. Facial. Okay? This function I can do. Rest I can't. If there is any lesion below that C3, C4, C3, C4, C5, what I can do now? What I can do? Respiratory is not there. C3, C4, C5 also not respiration. If it is below that C5, C6, I can do respiration. Even C4, C5, even I can use my deltoids. Even I can use my little of biceps. Okay, because of C5, brachialis are okay because the level is at C6. I can do this, but rest I can't do. If it is below that C6 and C7, even I can do some wrist extension and all. Okay, so below that I can do movements of upper limbs, but I can't do the below that. No abdominals, nothing. If it is below that, abdominals are good, but no lower limbs. Like that, as the level of lesion is going down, my functional levels will get increased. I can do more functions. The higher the level of lesion, less function. Okay, so based upon that, we have to assess and we have to do some compensatory, or you have to treat the patients. So better you can study in your book. I will give you in practical what level, what function can be expected. What level, what function can be expected. This is very important as a physical therapist. Okay, so that is about functional level. Okay, depend upon the level of lesion. Next, you know that grading of or knowing what is the level of injury and whether it is an complete, incomplete, you know that? Huh?
Yes.
So what about complete? What is A, B, C, D, E? There is A, B, C, D, E. What is A? Not. I am asking about Asia scale. Asia scale. So A is complete loss of sensory and motor below at the level of S3, S4. Even in the sacral, there is no complete loss of motor and sensory. Okay. B, sensory is good, but no motor at the level of S3 and S4. Understood?
Yes.
A is complete, no loss. B is incomplete, but incomplete, sensory is good, motor, no motor at the level of S3 and S4 and all the other things, below the level of lesion. And next is C, incomplete, where there is sensory is obviously good. Motor, if you see the motor, the muscles, the key muscles are having a muscle power less than 3. And what about the D? What is D? D.
Above sensory good,
sensory is good. Motor in the key muscles are more than 3. More than 3, but not normal. And last is E, normal. All sensory and motor is good. Okay. So this is how you have to check for the complete or incomplete or normal after spinal cord injury. How will you know this? Only by sensory and motor assessment. Okay, you have to apply this sensory assessment. Okay, dermatomal with myotome. Okay, myotome is manual muscle testing. Okay, compare it. You can know whether it is complete problem or incomplete problem or not. Okay, so this is the assessment part which you have to see in case of spinal cord injury patients. So what is the first one? First is what? Respiratory assessment. Respiratory assessment you have to see for functional strength of the muscles, their coughing and the muscles chest expansion, and also even you have to check for breathing, type of breathing, okay, and accessory muscles, the work of accessory muscles. Respiration is completed. Next you have to go for skin assessment, checking for the pressure source in the areas. Okay. Next is sensory assessment, motor assessment using manual muscle testing. Next, range of motions, both passive and active range of motions in all the joints. Next is what? Functional assessment. After that, you have to see for whether it is a complete or incomplete based on Asia scale. Okay. So that is about the